here, why don't we do one on each side?
Okay, great.
Okay, come on over, Stephen. Hi, thank you all for coming, and we're here to announce the introduction of legislation to repeal elements of the so-called One Big Beautiful Bill. That bill was a disaster, and we don't have enough time this afternoon, and it's too hot to talk about every provision in it that is bad. But an indication of the buyer's remorse that we're seeing is that folks who voted for the bill are talking about repealing sections of it. Senator Hawley, Senator Tuberville. But one of the things that is a common focus is that the provisions on Medicaid and the co-pays, every time you go to the doctor you're supposed to pay like $35, they're intended to basically discourage people from getting the health care that they need. That's one. I want to repeal that because it really is a device by which people who need health care don't get it. And the evidence is overwhelming that when you're talking about low-income people who are struggling to pay their bills, and they have to make a decision about that $35 before they decide to go see a doctor, they don't go. It literally happens. Now, that's not something that is on the radar for somebody like President Trump, who's made, I don't know, hundreds of millions of dollars in crypto since he became president. But there's a world out there in America where folks are really conscious about what to do with $35. Do they pay the utility bill? Do they go see the doctor? Or do they put some money down to try to get their kids a pair of sneakers for school? So this is real, and that's what is lost in this whole debate, is that everyday Americans who are struggling to make ends meet, raise their families, live in their communities, and don't have the income that they need with inflation, with affordability challenges, that $35 is real, and it is inhibiting folks from getting access to the health care they need. And there's a provision in there, too, that says the hospitals don't give them the care until they pay. Now, some hospitals, a lot of hospitals I know in Vermont are not going to pay attention to that, but what that's going to mean for those hospitals is that their finances go down, and they're already precarious. So we want to repeal those co-pays. It'd be about $5 billion. We're going to pay for it. That's different than this bill, which is about $3.5 trillion to the deficit. And we're going to pay for it by repealing a sweetheart provision in this bill that allows pharmaceutical companies to basically get out of some of the negotiation provisions that we passed in legislation during the Biden administration, price negotiation that would apply to pharmaceuticals. And there's a provision in here about orphan drugs. This is in the One Big Beautiful Bill, where they basically get a pass on price negotiation, even though the pharma companies have been abusing the intention of the orphan drug provision, and they've been abusing it for years. The orphan drug provision is about providing incentive for pharmaceutical companies to focus research on diseases that are rare. And what they then do is get a premium for the price of that drug. But what's happened, and this is the abuse, is that there is an orphan use for that drug, but then it becomes widely used for other widely diagnosed conditions. So what we would do is return the orphan drug provision to its original purpose and take away this bonanza and loophole that is enriching the pharma companies beyond their already fat profits. So number one, repeal the impact of these co-pays on the Medicaid population, let them get access to health care. Number two, pay for it by eliminating the sweetheart deal that goes to the pharma companies on the orphan drug provisions. So this is really important to the well-being of everyday Americans. Right now, I'd like to turn this over to the Deputy Director of Policy Programs of Protect Our Care, Vaishu Jawahar. Did I say it right?
Jawahar, yeah.
Jawahar. Thank you very much.
Thank you so much, Senator.
Thank you.
Hi everyone, thank you so much for having me here today. My name is Vaishu Jawahar and I'm Deputy Director of Policy Programs at Protect Our Care. I'd like to begin by extending my deepest gratitude to Senator Welch and Senator Wyden and their teams for everything that they do to stand up to protect the health and dignity of millions of Americans. Thank you for putting the needs of your constituents above the profits of big drug companies. It's much appreciated and this bill is much needed. Donald Trump's big, ugly bill imposes the largest cuts to health care in our country's history, and it's going to cause nearly 15 million Americans to lose their health care. Senators Welch and Wyden's bill identifies the worst provisions and stops them in their tracks because they understand that every single American deserves to have high-quality, affordable health care. Let's start with the Trump sick tax. Donald Trump is bankrolling tax breaks for the wealthiest Americans and most profitable corporations in our country by imposing a sick tax on families who are just struggling to get by. Because of the GOP tax scam, over 20 million Americans will be forced to pay new fees every time they need to see a specialist for diabetes, every time they need dialysis for their failing kidneys, every time they need to see a specialist for arthritis. Families making as little as $33,000 a year will be forced to pay the bill and will pay a cumulative $5 billion in new co-payments. The Trump sick tax sacrifices the health care of families who are working hard in jobs such as construction, maintenance, caregiving, all to give more tax breaks to the wealthy. Because of Donald Trump and Republicans in Congress, these families could face up to nearly $1,700 in increased out-of-pocket costs each year. For families living paycheck to paycheck, this means foregoing necessary care, ending up in the ER in worse condition, and drowning in medical bills. The GOP tax scam also raises drug costs for seniors and taxpayers while helping drug companies escape negotiations and continue to pad their multi-billion-dollar profits. In the wealthiest nation on earth, no one should have to choose between putting food on the table and getting the health care that they need to survive. No matter what they say, Republicans' actions speak louder than their words, and they are moving to boost drug companies' profits, hand out huge tax breaks to big pharma, and sell out their constituents. Republicans have broken the promise that they made to the American people to lower the cost of living, and millions of Americans are very much in need of this relief, and we are grateful that Senator Welch is introducing legislation such as the Repealing the Trump Sick Tax Act. Thank you so much.
Thank you. And now Stephen Hadfield, a patient advocate. Stephen, thank you.
Good afternoon, and thank you, Senator Welch and Wyden, for bringing attention to this important issue. My name is Stephen Hadfield. I am 73 years old, a husband, a grandfather, and a proud North Carolinian. I spent years fighting two serious diseases, a rare blood cancer and type 2 diabetes, while struggling to afford the medications that keep me alive. I worked 2 jobs just to cover my drug costs. I rationed pills, skipped doses, and prayed I wouldn't end up in the hospital because of it. Having worked my whole life, I should be enjoying retirement, but the high price of my life-sustaining medications make that impossible. That's why Medicare negotiation is such a breakthrough. The price of Januvia, the diabetic drug I rely on, was negotiated down from $527 per month to just $113 per month. And starting in January, patients like me will pay that lower price. I also used to take Imbruvica, a cancer drug priced at nearly $17,000 a month. I had to get grants to pay for it because it was simply unaffordable. Now, because of it's part of the Medicare negotiation in January, that price will be cut by 40%. But if the Orphan Cures Act has been passed into law earlier, Imbruvica would not have been eligible for negotiation, leaving thousands of patients paying a higher price indefinitely. This law is a $5 billion handout to Big Pharma and protects the high prices for blockbuster drugs, not a policy that actually helps patients like me with rare diseases. The truth is, the drug price reform is the Inflation Reduction Act maintains all the incentive drug companies need to innovate and develop treatment for rare conditions. It only allows negotiation for drugs that have been on the market for years and are bringing in billions of dollars. Patients know this carve-out isn't necessary, and we oppose it. In just a few weeks, patients from our community sent tens of thousands of letters to Congress urging legislatures to remove the provision. It wasn't added to help us. It was added because of the intense pharmaceutical lobbying. Patients like me fought hard to win Medicare negotiation because we need fair prices in line with what the rest of the world already pays for medication that keeps us alive. We cannot let pharma gut this victory. It is time to repeal the Orphans Cure Act and stand with patients, not big pharma profits.
Thank you.
You're very welcome.
Thank you, Stephen. That's great. You're going to save some money.
Uh-huh. The Inflation Reduction Act, you only have to pay $2,000 deductible.
I'm liking the sound of that.
The Inflation Reduction Act that was passed by President Biden.
I'm liking the sound of that. Any questions? Yeah, but by the way, that is amazing, right? What was the monthly cost and it went from 8 to what? You said that.
Januvia, which is my diabetic drug, one of my 3 diabetic drugs, was $527 a month, and it went down to $113.
So that's like $5,000 a year. That's that is real money. And that
and
was
now
public
instead of
policy.
Imbruvica, I'm on a new advanced one called Bukenza, which is a sister drug, and it's $18,000 a month.
Oh, God.
And then
Amazing.
Dupixent, which I advertise on TV, which I have to shoot in my stomach, is $7,000 a month.
Amazing. Thank you.
You're very welcome.
Any questions? Yes.
I'm Leah DeGroot. I'm with Roll Call. I'm curious if you thought about what kind of legislative vehicle you see for these provisions. Is it something you'd like to see in like a year-end package or anything like that?
Well, I mean, in a way, you asked the right question, and you know the standard answer. We're looking for any way we can get it in. And obviously, the way things are working around here, you have to get it into something like a year-end package, something that is moving. So that would be the goal. You know, the other question you ask oftentimes is, can you get it passed or not? And around here, that's a very tough challenge to get anything done. But what I'm noticing, and I'm sure you are too, is that many of the folks who voted for the One Big Beautiful Bill are now saying they want to undo major elements of it, like Senator Hawley on Medicaid, like Senator Tuberville, who is nothing if not a totally loyal Trump supporter. But what they're seeing is the same thing I'm seeing. They're seeing it in Alabama, they're seeing it in Missouri, the same thing we're seeing in Vermont. This is really consequential for the people they represent, and it's really a dire threat to the well-being of the community hospitals. So, you know, a year-end vehicle might be the way to do it, where they can sort of be under the radar a little bit about doing something good for the people they represent.
Any other questions?
Well, thank you. Thank you. Hot enough for you? Oh, thank you.
Thank you so much.
Really appreciate it.
Thank you very much.
Terrific.
Thank you.
Excellent.
Right.
Appreciate you coming to this spot.
I'm fine. Just Google my name. You'll see all this stuff. I've been in D.C.
I know that.
He's
I
been
know
a
that.
State of the Union guest.
State of the Union for Joe Biden.
Really?
Yeah.
Cool.
And the motorcade and everything.
In the motorcade?
Uh-huh. And then before that, I was in, I think it was the Blue Room, where we introduced President Biden's Inflation Reduction Act.
Oh, cool. That's great. Thank you.
We
It's
grab
an
a
honor
quick
to meet you.
photo maybe under the shade
Okay.
here.